Hello, I'm Dr. David Degatti. Thank you for joining us for today's episode of Catholic Health Stronger Together with Dr. Dave. Today, we are going to discuss how Catholic Health strives to make each patient's experience as positive as possible. Anyone who's visited a physician's office, hospital, or any medical facility knows the importance of a positive patient experience. Our promise to all who turn to us, patients and their families alike, is to deliver an unparalleled care experience in every encounter. Catholic Health's culture is noted for its human compassion rooted in our founding mission. It's part of who we are and a big part of what makes us a different kind of healthcare system. Whether we're ministering to a patient in a hospital bed or answering a family's questions or just guiding a visitor to the right hallway or elevator, you'll find the Catholic Health commitment to care visible. It infuses every level of our organization, making Catholic Health one of Long Island's most patient-focused healthcare systems. Our nationally recognized hospitals, physicians, and nurses provide exceptional medical expertise delivered with the comforting confidence that sets us apart from other healthcare systems. To discuss how the integrated healthcare system delivers an exceptional patient experience is Catholic Health's Chief Medical Officer, Dr. Jason Golbin. First of all, thank you for taking time out of your busy schedule. You're doing an amazing job, but your role with Catholic Health is incredibly important. And it doesn't get a lot of the attention that some of the other roles may get, such as mine, but yours is definitely very important. So why don't we start with the obvious question? How do you ensure a consistent experience with 16,000 employees, 6 acute care hospitals, 3 nursing homes, a home health service, hospice, and a network of physician practices?
The short answer is, the serious answer is that we put the patients at the center of everything we do. And we do that every patient, every encounter, every time. I mean, that is what we live by. The not so short answer is it's hard. It's really, really hard. We are working day in and day out to build that level of consistency into the care we deliver. As you know, our goal is to provide the highest quality, safest healthcare. 0 harm is our goal, but to provide the best possible patient experience throughout the continuum of care. It starts when you look up the doctor on the internet, or when you make a call to the office, or when you show up in the emergency room, which is really like our front door at the hospitals. By placing the patients at the center of everything we do, that's how we retain that focus.
It's amazing. And I see a lot of patients in the office, and I see many after they're at a Catholic Health facility. And I have to tell you, what impresses me most about what you and your team are doing is it really is true. Every single patient feels they're the only patient in the hospital, that every service, all the attention is geared towards them. And to me, I'm so impressed by that, because we see so many patients every year, but to have a patient leave that facility with that impression is unbelievable. It's really remarkable. So you guys get a lot of kudos.
Thank you. I'm not sure we're there yet, where it's really every patient every day. We are working in that direction every patient, right? That's the only way we know how to get there. But let me tell you a little how we've done that. In approximately 2015, Dr. O'Shaughnessy, he had this vision that we should be a high reliability organization. And so you'll say, well, Jay, that's great. What's a high reliability organization? It's an organization that, despite a super complex operative area, a million complex moving parts, delivers safe, highly reliable service, because it's not always in healthcare. It's usually not in healthcare, every time. So an example of this, commercial air travel, right? We don't worry when we get on a plane. Thank God, right? Some people may, but in general, it's part of travel. We check in. The worst part is going through security, and we go on the plane. We don't think about it. We're going to take off safely. We're going to land safely. But so much has gone into that, and they really have changed the world of commercial airline travel to be as safe as there's been years without fatalities. And that's remarkable given the amount of travel and the amount of commercial airline flights that occur regularly. Another example of this is a nuclear power plant. Think about it. I mean, you can think of the few exceptions to the rule that those nuclear power plants are running 24 hours a day, 7 days a week, 365 days a year, all over the world. It's about persistent mindfulness and a focus on super high quality, safe operations. So Dr. O said, that's great, but why can't we apply that to healthcare? And he started us on the high reliability journey. So we worked with a company called Press Ganey, very well known in the healthcare stratosphere. And we said, what does it take for us to become highly reliable? So the first thing we did was we developed what's called the daily patient safety principles, where this is essentially our guidelines, our list of behaviors around safely delivering care to make sure we provide the safest care possible for our patients. I'll give you an example. We have something called Speak Up, and we call it CUS. C-U-S is a mnemonic. And so anybody and everybody is empowered, frontline person. So let's say you're going to go do a procedure in the office or in the hospital, and somebody sees something that just doesn't look right. Well, they can speak up and say, Dr. Dave, I'm concerned. Did you check X, Y, and Z? Let's say you don't respond to that. Then they can say, well, Dr. Dave, I'm uncomfortable. That's the U of CUS. And ultimately, everybody and anybody, including environmental services, nursing, you name it, can stop the line. That's the S, and say, stop the procedure, stop what you're doing. I have a concern and I need to be heard. And it's worked incredibly. We've empowered staff. We've decreased the power distances. So everybody's comfortable to speak up. So it helps us breed a safe, highly reliable environment. So we have a number of rules like this. There are stuff called red rules, which are absolutely never to be violated. The 2 patient identifiers. So I'm sure when patients come to see you in the office after they've been in the hospital, they say, they were in and out 50 times a day, right? Everybody comes into the room, but every time they ask me my name and date of birth or name, and they wanted to see and I don't understand. Don't they know who I am already? Now, yes, we do know who the patients are, but the red rule is that we have to do 2 patient identifiers on each and every interaction. We check a name, and we check the name band, or we check a date of birth. It's some other identifier to make sure we're always dealing with the right patient to avoid any type of harm. Make sure we're doing the right patient. So these are the daily patient safety principles we built. So we built out a system-wide training program, which you took as a member of our medical staff. I took as a member of our medical staff, and in which we trained 1,000 leaders. So here's the leaders course. The leaders need to know what we're doing. Then we trained trainers, and then we did a train-the-trainer model to train all 16,000 employees and all 3,000 to 4,000 medical staff. And we made it a condition of medical staff credentialing. So to be in one of our buildings delivering care to our patients, you have to have taken a safety training.
It's amazing. And you know what I love about all this? We've been doing this a long time. I remember the traditional model of medicine. The doctor says it and it's right, and nobody is to question it. And what I love about what Catholic Health is doing, and I think patients watching this right now can really feel secure that, the doctors have become very humble, and we realize we're part of a very big team. We're not there's no boss anymore, right? It's a team effort. And I love the phrase you said, persistent mindfulness. I love that phrase, because as doctors, we need the help of environmental, of the nurses, of anybody else who can add the eyes and ears, because we know in the hospital so many variables, so many things, so many moving parts. So it's, I'm so excited, and it makes me feel as a physician, but also as a family member, that if my family ends up in a Catholic Health facility, I know that the likelihood of a medical error, which we hear about all the time throughout the country, is very low. So it's really reassuring.
Since we started really tracking the amount of serious safety events in 2018. We increased our reporting because you have to be aware of what you have. Once we knew what we had, we then set about reducing it. And when we finished out 2021 with an 80% reduction in serious safety events.
80%.
80%.
That's unbelievable.
It's unbelievable,
Yeah.
right? It's amazing. That's X many more patients who go home safely to their families, to your family, to my family, right? Because my family, just like your family, uses our hospitals.
Right.
Are we where we need to be? No. The goal is zero harm every day, every patient, every encounter, every time. But we are continuing to strive in that direction, and everybody's, I like to say, rowing in the same direction.
Yeah. And it's great because I think, when we admit one of our patients from the office to the hospital, we don't even think twice about the level of care they're going to get. The level of care is going to be at least outstanding. And it's just reassuring. And to me, if you go to most hospitals in the country, similar things are treated similarly. DVTs, heart attacks, lung infections. The difference between good and great, to me, is not always the medicine. It's really the behind the scenes. It's what you're talking about, the checks and balances that make sure that these mistakes that are almost always preventable don't occur. It's so exciting to hear that this is happening. It gives me so much confidence that next time I admit a patient to the hospital, it's only going to be an amazing experience. You've basically have taken over the realm, and what I like so much about what you've done is you've really taken it on your shoulders. You've taken full responsibility. What is leadership accountability?
When we envision high reliability, we envision a circle with 4 quadrants. We have quality in the top left and safety in the top right. And then on the bottom, we have 2 other categories, which we don't necessarily traditionally think of in healthcare. One is patient experience, and one is employee engagement. So we said, all right, we're moving on quality, we're moving on safety. Let's talk about patient experience. And we said, that's our next challenge. So first thing we do is do an assessment. Where are we? And we had pockets of incredible performance. If I can call out St. Francis Hospital, right, has been nationally top 10%, sometimes top 5% of all hospitals in the nation on the experience of care, which is, like you said, it's not, did I write the right medicine? Did I make the correct diagnosis? It was, what is the patient's perception of the care that I received, of the experience I had? Was I treated with courtesy and respect? Was I communicated with? Did I understand my plan of care? The assumption is that we're going to do the right thing medically, right? That's the assumption. But do we do all the other things? I used to say the soft things. Right. It's not. If anything, it's more important because, like you said, there's only one or two ways to treat a DVT, right? So that's the difference. We said, okay, we have to go after that. Well, we said, we know what worked with safety. Why don't we replicate that with patient experience? And that's the journey we started. So again, we partnered with our colleagues in Press Gaining, and we said, we have the daily patient safety principles based on what we know was not working as well as it should. We're going to build up the daily patient experience principles. So it's a 1-pager on both sides, and it's a list of expected guidelines, behaviors, how patients should be treated.
That's fantastic. Unbelievable. So, all right, let's take a break. When we come back, how did Catholic Health do things differently to achieve significant results, and what does that mean to you as a patient?
Got your personal references, high school diploma or equivalent?
Skip the drama. Get your diploma.
It's right there.
Find free adult education classes at finishyourdiploma.org.
Are you ready to open your heart and home for 18 months to a puppy like Esther? To find out more about becoming a canine companion for Independence Puppy Raiser, visit cci.org or call 1-800-572-BARK. You can make a world of difference in the life of a person with a disability.
Welcome back to Catholic Health Stronger Together with Dr. Dave. With me is Catholic Health Chief Medical Officer, Dr. Jason Golbin, explaining how Catholic Health provides a superior patient experience across its entire healthcare system. Okay, Dr. Golbin, so we've covered a lot of ground. What did you do differently to ensure an optimal patient experience?
So, great question, and my favorite topic of the day, right? So, you understood all the work that we did around safety. You've been part of it. But when I came over directly to work for Dr. O'Shaughnessy as the System Quality Officer, Chief Quality Officer in 2017, we said, we've made amazing strides in quality and safety, but we know there's more towards hitting what I call the bullseye of high reliability. Actually, we use a graphic, which is a circle that we split into 4 quadrants. And we put quality and safety in the top left and right. And then we put patient experience and employee engagement. Much harder, and not necessarily what you or I learned about in medical school, right? We learned how to make a diagnosis and give the right treatment. We didn't learn about how to provide a great experience or about how to make sure staff are engaged. Now, some people do it naturally. You do it naturally. I've seen you do it. But we need to train everybody on that. So we worked again with our colleagues in Press Gaming, and we built out the daily patient experience principles to be analogous to the daily patient safety principles. List of standardized behaviors, what we expect, some simple stuff. Walk into a room, introduce yourself to the family, knock on the door, eye to eye and heart to heart. So if you put your eye level and heart level, patients feel that. The hardest thing, I think, and the thing that we've been working so diligently to teach, and you may say, is this teachable? I think so, is empathy. So empathy is different than sympathy. So we developed a principle called ESP, which is empathize and then stop and then probe. So let me give you an example. Let's say you're upset, your family members in the hospital and they're waiting on their CAT scan and it's just not happening. Now, behind the scenes, we may have very legitimate reasons why the CAT scan is delayed. Traumas came in the emergency room. This crisis was upstairs, and this one is not as critical. So we try to always shuffle the deck to make sure the most critical patients get to use the resources first. But you can be upset, and you may say to me, Dr. G, what is taking so long? I'm worried about my, mom, dad, brother, sister, and what we're teaching everybody is to use empathy. So first, empathize. Call out the feelings. I hear how upset you are. I see how frustrated you are. I can imagine how challenging it is for you. And then pause and allow that to sink in. I got you. I'm with you. I hear you. I understand. And then we call it probe. What can you do? Because we're problem solvers, right? That's why we pick medicine. We're going to solve the problem. How can I make this better? Let me go check. I will personally go down to CAT scan check, and I will be back here in 10 minutes to close the loop with you. It's really about active communication. It's not easy. I will say up front, as the leader of this program, I did not know how to use empathy. I tell a story. You know that many of my patients, unfortunately, I make the diagnosis of lung cancer, right? Part of the job. And what I would do whenever I knew the results, I got a CAT scan, I sent someone for a biopsy, and I knew the results, and they were coming in to get their results. So the first thing is, we always think of the patient in front of you that could be your mom, dad, brother, sister. We teach, you and I teach medical students, we teach them that. I like to say your picture person. Who's the picture that you look at on your nightstand before you go to sleep and when you wake up in the morning? So that's rule number one, that person is that important. And then I would prepare everything. I'd call the surgeon. I'd arrange with the oncologist. I'd set the appointments. I'd make sure I had everything in line. And then the patients would come in and they'd sit down with me and I'd say, I'm sorry, the biopsy shows that you have lung cancer. And I wouldn't stop. I would just say, here's what I did. I sent you, I spoke to the surgeon. He saw your CAT scan. He's going to see you tomorrow morning. And then you're going to see the oncologist. I would set everything up. And chances are the patient's still on what he said. Right. I've learned how to incorporate empathy. It's really an incredible tool. And I've learned to pause and then probe. I may still have the full plan in the back of my mind, but I'm not just going to bring it out there with a little bit of sympathy. So it's been a game changer for us across the organization.
It's amazing that this is not taught in medical school. I always tell people, just treat everybody like you'd want to be treated, or you would treat your own family, assuming you like your family.
Exactly.
But it's amazing how, and you hit the nail on the head. The analogy would be, I tell a patient that I think they have a blocked artery, and then I spew out everything I'm going to do for them. But what does the patient remember? I think you have a blocked artery, and then they forget everything else, right?
I'm going to die.
So yes, exactly. They go to the worst place. So it's so important to have this empathy and almost put yourself in their shoes. And if a doctor was talking to me, how would I want that physician or healthcare provider to present that news? You know, what's going to make me listen to them and hopefully leave the office reassured that, you know, I have a good chance at beating whatever they think I have.
Agreed. So we built the program, we built the daily patient experience principles, and then we set forth to do exactly what we did with safety. We trained 1,000 leaders across the organization. We trained our trainers, and then we went out and trained all 16,000 employees and all medical staff. With the buy-in of the physicians of our organization, I thank them so much. It is a requirement to be on staff at one of our hospitals that you have to be trained in both safety and experience, and you have to do it every time you come up for credentialing, which is every 2 years.
So hold on, experience is empathy?
Empathy is a major piece of
so
our
we're
experience program.
teaching healthcare providers empathy.
Yeah.
So amazing.
It's really amazing. And we tell them, look, we're not here to teach you how to be a doctor or a nurse or an environmental service worker or anybody. Right? We're all critical. Like you said, it's one team. But we are here to help you communicate with patients in a better way.
So is empathy teachable? In
I
your
think
experience,
empathy-
are you seeing a difference?
I'm case in point, right? Again,
Right.
I put myself out there and say I didn't understand it, and now what we like to tell people is you don't just have to use this in the hospital. Take it home. I have, as you know, I have a young toddler who's quite a wild man, and if you read the books about how to talk to a 2-year-old, use empathy.
Right.
So I'm actually using ESP on my toddler, and
It's hysterical.
it actually works. You
It's
know,
amazing.
he calms down. Okay, I'll have a cookie. You know, kind of thing.
So you know what's great about this show, everyone, is we are giving medical advice, but also family advice. So you can learn a lot by watching this show. So we've learned today that doctors can be taught empathy, and we learned how to talk to a 2-year-old. So we're accomplishing a lot today. So I have to have you on the show more often. This is
Bring
fantastic.
my baby, you know.
So it's so amazing to me that doctors can be taught empathy because, you know, the part of me thinks the problem with medical education is, you know, I think empathy is almost driven out of doctors through the medical education system. We're taught about science, and treatment. And I think we all go into medicine wanting to help people and make a difference. And I think sometimes it's beaten out of us because there's so much emphasis on learning science. And now what we're doing is we're coming back and we're trying to bring back the empathy that made all these people go into medicine to begin with.
I love it. It's great. Now, it's a great way to think about this. Certainly, there's some medical schools out there. When you and I went to college, our major was biology, right? That's always science, chemistry, physics, what have you.
Right.
And now the liberal arts background is recommended. That's what they're looking for to develop a much more well-rounded physician.
That's so interesting. Okay, great. So we have to take a short break, but we will be right back.
Discover immunotherapy and find out how your body's natural immune system can become your greatest hope in the fight against cancer. Speak with your doctor and visit su2c.org/immunotherapy to learn more.
Welcome back to Catholic Health, Stronger Together with Dr. Golbin. Catholic Health won an award from the Healthcare Association of New York State, or HANES, for its patient experience program. Let's take a look.
When we looked at the data, we saw that our quality and safety was good, but the patient perception was not. Once we made that assessment, it's as if we made our diagnosis. Okay, this is the next step. We need to work on patient experience.
We call it the golden keys to eye care behavior.
I have my key right here.
And they follow our values, our core values. So they follow integrity, compassion, accountability, respect, and excellence. And really we focus on putting the patient at the center of everything we do.
It's not just about the clinical care. It matters how you treat patients when they walk in the door, when they're actually getting their care, and when they are home and potentially get a bill.
The first thing we did was say, this is not the flavor of the month. This is not an initiative. This is a transformational program for the organization.
The way we focused our program on culture change, that's where I think we met with success, and that's the key to making the change and also sustaining the change. So one of the ways that we foster that is through implementing appreciative coaching.
Appreciative coaching is a behavior methodology tool that we use. A manager goes out with the care team member and with a patient.
And you mentioned 5 great things that they did in the interaction, and then the one opportunity they have to improve.
It's taking an interaction that might be good and then making it great or excellent. The reward has been knowing that at the end of the day, we're making a difference.
It's really about how you treat a patient.
We aren't the biggest healthcare system, but our goal is to be the best.
And that's what makes me really proud to be part of this program, because it's making a difference in people's lives.
It's fantastic. And it just, again, it resonates the idea that Catholic health really is different. It's a different system. I've worked at many different health systems. I've never worked for a system that was so personal, that was so personalized. And I give you a ton of credit. I give Dr. O'Shaughnessy. It comes from the top down. It definitely does. And I think you guys are doing such an amazing job just in a few years. An increase by 100% is just unbelievable. And I would not be surprised if other health systems around the country come to us to watch what we're doing.
So 2 things. Number one, we just recently presented at the National Patient Experience meeting to share what we've done exactly. And I want this. So appreciate that. Number 2, I think you're right. It really comes from the leadership at the top. I have my favorite quote of all of this work is, attention is the currency of leadership. Whatever the leaders are paying attention to, that's what everybody else is paying attention to.
That's great.
And I thank Patrick every single day for his leadership of this huge organization and paying attention to what matters.
Right. It's so exciting. So exciting to be part of such an amazing body of work that you and Patrick and everybody on your team, because there's a lot of people on your team we're not even mentioning, and they make you guys look really good. So, so that's
I thank them.
That's fantastic. And I just want to thank you for taking time out of your busy schedule to join us here on the program.
It's an honor and a pleasure.
Well, thank you.
I'll see you in the gym later.
Yeah, absolutely. And I hope everybody watching learned something. And what we try to do this episode is really give you the inside look as to what really happens when a patient goes into the hospital and the experience of that patient. There's a lot of work behind that. It's not just by chance. It really is a lot of practice. So until next time, Dr. Golbin, thank you for joining us on the show. For more health information, tune into Catholic Health Stronger Together with Dr. Dave. If you would like to know more about Catholic Health's patient experience or to make a gift in support of this or another program that is important to you, please visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. David Degatti, and I hope to see you next time on Catholic Health Stronger Together with Dr. Dave.